Thank you very much. Thank you for having me here. So I guess that most of you are very familiar with PrEP. So this clinical case might be, well, back to basics, but it's an illustration of PrEP medical visits and discussion of PrEP regimen. So this is a case that we have seen in the infectious diseases department in Saint-Louis Hospital in Paris. So it is a young man, 28 years old, who has the characteristic of having a kidney disease. He has a vesico-urethral reflux and needed surgery, and so he has an altered renal function. He doesn't take any medication, he's an engineer, he doesn't smoke, and he doesn't drink alcohol. So about his sexual habits, so he is a man who has sex with men, mainly on weekends. He has multiple partners, sometimes without condom, and mainly receptive anal sex. He sometimes uses drugs, especially 3-MMC, and very recently he had to take post-exposure prophylaxis, which ended recently. He's had several sexually transmitted infections. So he's had syphilis a couple of years ago, and more recently gonorrhea. So he comes here because he wants to discuss beginning PrEP. So these are the test results before PrEP. So we see that he has a mild kidney disease with an elevated creatinine. He weighs 52 kilos, and so his eGFR is at 70. His liver enzymes are normal, his blood cell count also. The serology for hepatitis are negative, so, well, we could suggest vaccination for hepatitis A and B. And currently he has no sign of active syphilis. The PCR testing for bacterial sexually transmitted infections were negative. So the first question, is this a good indication for PrEP? So, yeah, you're nodding, yes. He's quite a good candidate for PrEP. Well, he is a male who has sex with men. He has multiple partners. He has unprotected sex. He lives in Paris, where there is a higher HIV incidence than in other French cities. He uses chemsex, and well, he's already had sexually transmitted diseases, and he just had a post-exposure prophylaxis. So he is at risk of a HIV infection. So there is no doubt about the benefit of PrEP, then it has to be balanced with the risk considering his kidney disease. So what tests are missing in the blood test I show you? Well, the most important one, so we don't know his HIV status. So, yeah, so we have to have a recent HIV serology, and also in the context of recent exposure, we should also add PCR testing for HIV and, well, closely monitor the risk of infection. So then it will be, well, we will discuss the regimen that we will choose for this young man. So daily PrEP or on-demand PrEP. So for him, well, on-demand PrEP seems more appropriate because of his kidney disease. So, well, it's probably preferable that he has low exposure to tenofovir, especially as it has been shown that there is a dose-response relationship between tenofovir and a decrease in eGFR. Also, he says that he has sex mainly on weekends, so it seems easy enough to program the first PrEP intake. he doesn't have a hepatitis B, which would only leave the option of a continuous PrEP. We might suggest on-demand PrEP for this young man, keeping in mind that, well, there might be more risk of gastrointestinal adverse events and, well, less protection if he forgets pills. So after 1 month, well, he took PrEP as decided. He took on-demand PrEP during weekends. He didn't have any adverse events, but he says that he forgot a pill 1 week before the medical visit. The initial HIV tests were negative, and these are the tests at 1 month. So the HIV serology is negative, but we see that creatinine is more elevated than at baseline, and that there is a decrease of eGFR, which has gone from 70 to 60. So what should we do about his kidney disease? It's probably enough for the moment to, well, closely monitor his renal function and to monitor creatinine and eGFR every 3 months, and, well, to consider stopping PrEP if he has repeatedly under 60 of eGFR. Well, in the Hypercare study and the open label extension, there were very few patients who had to discontinue PrEP because of eGFR decrease under 60. So it was 1%, and it was about the same figures with the Discover study as said earlier. For this person, we should also look for tubulopathy, so also ask a urine sample and to search for tubulopathy, but as well, there were very few, nearly none of Fanconi syndromes in people taking PrEP. So if we decide not to pursue on-demand PrEP, what other options can we discuss for this young man? Yeah. So the first option could be TEF, which is interesting in the context of his kidney disease. For the moment, it is not available in France, only through the Discover protocol, but it could be discussed. What we have to see with this patient is that, well, is there really an adherence problem, because it would be a switch to daily PrEP. The other option would be long-acting cabotegravir, which is interesting as well, considering the kidney disease and considering the potential adherence problem. So for the moment, it's also not available here. But what we did is that for the moment we continued on-demand PrEP, and we suggested that he could participate to a cabotegravir protocol when it is available. And this man was very eager to switch to intramuscular treatment. So just a bonus question. So at the 3-month visit, which was about last week, he wanted to be checked for genital lesions. He said he attended a gay event in Berlin that was in the middle of May, and that 7 days later he described the appearance of genital lesions, for which you have the photographs. One near the external urethral orifice, and the second one on the side of the penis. He had no other symptoms, and he self-medicated with several antibiotics and anti-herpes treatments without improvement of the lesions. So the second lesion appeared 3 days later, and he comes to the medical visit because it hasn't improved. At the physical exam, there are no other signs except an inguinal adenopathy. So, what diagnostic tests would you do? Yeah, probably HIV. Well, in the current context, epidemic context, before sending local samples and blood samples to multiple labs, we first looked for monkeypox, and it was actually very positive on these lesions, with quite an atypical clinical presentation with exclusive genital lesions, no general signs, no fever, no headache or muscular pain, and well, no characteristic skin lesions, even though the genital lesions were a bit vesicular, and well, evolved with crusts, and they have almost disappeared now. Thank you.